As you may have known, my name is Sahr, which actually translates to dawn in Farsi, but is a little bit contradictory because I'm not a morning person. I am currently a PhD candidate at the U of T, and where my current work is really focused on integrating the core applications of community-based research within the user-centered design process to develop more impactful interventions for underserved and under-resourced populations. But beyond my academic title, and more importantly, I am a daughter and I am a sister coming from a family of 7, where despite being born and raised on the lands part of Treaty 19, my ancestral roots are actually from Afghanistan, where my parents were actually fortunate enough to immigrate to Canada during the end of the Soviet invasion. And much like many immigrant stories, they came here with nothing but family. So today, as I reflect on my personal journey, despite not sharing the struggles of my parents' past, nor the privileges of the kids I grew up with in Milton, I always felt that although I was born in one country, I didn't necessarily identify or completely belong with either. But what I've learned and what I continue to learn today is that I don't really have to. And the beauty of reflection is that now I can see the strengths of both cultures that really who have shaped who I am and who I want to become. And I think that's really the underlying premise of my research and my work, where the entire purpose is really to see the strengths of context of not only where we come from, but where we want to go and who we want to become. And so today, as I join you as part of the lands from what is now known as Toronto, I would like to acknowledge that these lands are part of the traditional territories of the Mississauga of the New Credit First Nation, Anishinaabe, Wendat, Huron, Haudenosaunee Indigenous people. So with all that talk about context, it was a long introduction and the importance of self-reflection. For today's presentation, I will be discussing the findings from my scoping review, evaluating the use of community engagement in the design and implementation of interventions for Indigenous communities. And if you guys have any questions along the way, you can feel free to raise your hand or leave them at the end. It won't be too long of a presentation, so hopefully we'll have lots of time for discussion. So despite facing centuries of colonization, Indigenous people have remained resilient in maintaining their cultural identity through their connection with their values and the land. But unfortunately, a consequential result of facing years of adversity has really led Indigenous people to experience a disproportionate level of poorer health outcomes compared to non-Indigenous populations. And specifically, while the rate of communicable disease has declined in many Indigenous populations, chronic disease prevalence has significantly increased in many Indigenous communities. Now, while it's important to note that many of the unique issues Indigenous populations experience are really deeply rooted in their colonial history and the disparities in their social determinants of health that has subsequently impacted their physical, mental, emotional, and spiritual well-being. Now, with this increasing recognition for various social determinants of health influencing health outcomes, many strategies to support Indigenous health have begun to incorporate or integrate the use of community engagement to better understand local contexts where traditionally Indigenous-focused research really used Western-based methods to investigate or improve Indigenous health, but these studies really had little success, mainly due to the investigators' a priori assumption of the issue to be addressed and the intervention to resolve it. So with this, we're now starting to see a shift where participatory research has become commonly used as a study design, as it places community members at the center of the research process in order to strengthen community capacity and promote meaningful change. Within participatory research, there are a number of different research approaches, all which differ in their methods, goals, and degree of participation. And the most 2 common that I have found or come across is first, participatory action research, where the community really leads all stages of the research from identifying the issue of concern to the resultant mode of action. And second, community-based participatory research, or CBPR, where community engagement is used across all stages of the research process, but it's not necessarily a requirement. So what I mean by this is that in PAR, if you're not necessarily having that level of engagement, a lot of PAR researchers won't necessarily consider your study to be within that study design, but CBPR just necessarily encourages the use of engagement. And this is where that big dilemma comes of what does engagement really mean? So with that problem, despite many of the ideologies between participatory research, a lot of studies indicating the use of PAR and CVPR have included these varying features within their methods that do not explicitly align with one another's study design classifications. Many studies that have specified that they've engaged with communities or conducted PR, but there's this lack of clarity on what that term engagement really entails for each researcher with respect to their study methods, their principles, their values, as well as their data collection instruments. So with that, we find that this term of community engagement or participatory research is often really used in this tokenistic manner without properly evaluating the methodological validity of its claimed use. Previous studies have also developed implementation frameworks to guide researchers in developing and implementing health interventions with Indigenous communities. Specifically, the Hipikingwa Waiora, or HPW, is an example of an implementation framework that has been used in a few PR-based studies within this review, as well as within other studies to guide their research methodology, where HPW is really intended to be used as a planning tool, where Indigenous self-determination is used as the core value of the framework, and 4 essential elements are used to guide the intervention's development or implementation. The first being culture-centeredness, second being community engagement, third being systems reflection, systems thinking, and the fourth one being integrated knowledge translation. Now, this framework really emphasizes the fundamental components of conducting Indigenous-based research by including the community voice, reflexivity amongst researchers, community involvement, and shared decision-making to encourage holistic perspectives of health. But the gap in this framework in a lot of Indigenous-based frameworks is this recurring issue where, despite highlighting the principles to be considered when designing or implementing an intervention, they do not specify the specific steps or core requirements to appropriately meet the criteria outlined in their framework. So with this, researchers are once again left in the position to make their own judgment on the level of engagement needed to meet the framework's guidelines. So with that, with this lack of a proper definition or methodological guideline regarding participatory research, there's this need to evaluate the varying modes of participatory research or community engagement to better guide future studies on Indigenous health. So as a result of this gap, the objective of this study was really to explore the level of engagement used across the different steps of the research process for the design and or implementation of chronic disease-based interventions for Indigenous populations so that we can create a series of recommendations to guide future research. To facilitate this objective, we use RC and O'Malley Systematic Scoping Review Guide as the methodological framework. With respect to the eligibility criteria, studies were included if the primary intervention had any source of community engagement used, as well as if they served a distinct Indigenous population for at least one chronic disease. And when I say Indigenous population, this is not limited to the Canadian context, but we included studies from Australia, New Zealand, anywhere where a population or group was of their origin. And also I wanted to recognize that a lot of studies were excluded if they ascribed the mode to conduct Indigenous research, but they didn't implement or apply it within an intervention design or implementation of an intervention, just because there's a lot of research that speaks about the availability of methods and the value of different methods, but there's a limited number of studies regarding the use of these methods when applying or developing a solution to improve Indigenous health outcomes. So as a result of this review, we found a total of 3,393 articles, but only 23 met the eligibility criteria for this review. To evaluate the extent community engagement strategies were incorporated, this review assessed the presence of community engagement across the 10 components of the research process, as depicted on the table on the right. Now, despite most studies indicating the use of a participatory model or framework, very few studies had involved the community within the research process steps. The most common level of engagement shared was that studies would get research approval from either an elder or a community council, as well as they include some source of community engagement to modify or adapt the intervention. Most notably, there was only 4 studies that actually involved community members to confirm the area of priority, and only 1 actually had the community identify the area of priority themselves. So with that, you can already start to see the trends and inconsistencies regarding the level of engagement efforts used. Overall, the majority of studies really agreed on this beneficial necessity to engage with community members to ensure the uptake and sustained use of an intervention. But despite the agreed benefits of using community engagement methods, this really found that studies included a varying number of community engagement methods, which ultimately limited the overall impact of their work. So to provide some examples, you can see that within the design, data collection, and data analysis phases, there's really minimal engagement used across those 23 studies. So we begin to kind of question, are these studies conducting meaningful work, or are they just conducting work that has been approved? So building on these findings, to better characterize the specific engagement methods used, we broke down the engagement features by 2 dominant themes. The first being adapting for cultural appropriateness, and the second being the inclusion of community outreach. Amongst the first theme, the importance of adapting for cultural appropriateness was identified as a key component across all the studies included to improve the uptake and sustained use of an intervention. And this included things like using Indigenous interview styles to promote meaningful feedback, or confirming the features of a program within the community that they would be using it. But despite the importance of these features, once again, it's important to recognize that all of these studies recognize the importance of having the community confirm the validity of their intervention, but less than 9 studies had actually incorporated some sort of a community involvement to further validate their intervention of use. Similarly, the second theme of community outreach, when it was discussed by the majority of the studies, we found that researchers, they often obtained the study approval by the elder or the local Indigenous Ethics Council, but beyond that, there was really very minimal inclusion used, where a lot of the times we found that if there was a focus on diabetes or heart health, Indigenous ethics councils would approve the study in preface that some sort of involvement would be integrated by the community council to depict their methods or their analysis stages, but there was no sense of feedback provided back to the community in order for them to essentially direct what should be done for their population that they're serving. So with that, overall, with the historical mistrust between Indigenous communities and researchers, the majority of studies, they agreed on this beneficial necessity to engage with communities. However, there was a lack of a cohesive understanding regarding the minimum community engagement efforts needed, which really led researchers to initiate studies based on their own interpretation on what level of community engagement was sufficient. So with this, we chose to summarize the supported engagement methods from this review into a series of recommendations to guide future Indigenous-based research. And before I get into the recommendations, I just wanted to recognize that the basis of these recommendations are really grounded on the ideology of your truth is not my truth. And what I mean by this is that oftentimes we characterize certain population groups based on their deficits without considering the systemic situation that has led to their current circumstance, where despite many populations remaining resilient in maintaining their cultural identity, they've experienced different disparities in their social determinants of health that have ultimately impacted their current state of well-being. This can involve their upbringing, their family dynamic, their living situations, or simple things that we take for granted, like broadband or electricity. So with this in mind, it would almost be impossible for our version of the truth to be the reality of their situation. So when we consider designing specific interventions or programs, we really have to consider these various contexts in mind and the priorities that come into place. So with this, the first recommendation that we came up with was probably the most important, and it is the initiation of partnership, where, to better evaluate the community's needs and the most suitable approach, initiating a partnership with the population is essential to build trust and room for open discussions. Ultimately, by initiating a partnership, this would open a sense of dialogue between the community and researchers to better evaluate the community's research goals. And through these discussions, the reviewer should be able to provide, or the researcher, I apologize, should be able to provide details to the community regarding, what types of engagement methods that they can use, how involved the community can be throughout the research process, and whether the study that has been proposed really aligns with what the community's priorities are at this current state, or if there should be a pivot to both understand, what is of higher priority or lower priority in order to come to some mutual understanding for the study purpose. The second one is the study approval. So following the finalization of study methods through all those partnership efforts, it's really important to obtain a final study approval to ensure that any overlooked or new issues have been accounted for. Oftentimes, as researchers, we only obtain REB approval, and then we come to the realization of these unforeseen restrictions once the study is to begin. But what we fail to do is go back to the community and ask, hey, this REB has been approved, but does this still align with what the community holds as priority? So many times, and in the time of COVID, there were so many shifts in priorities that we failed to recognize that the 8-month previous REB application that you have submitted may not be relevant anymore, but to continue with your study and ensure that the cultural appropriateness of the project you're proposing aligns with the community's values. That's why that importance of continuous dialogue and approvals is so key throughout the research process, not necessarily the one stamp that you get to move forward. And finally, we recommend to researchers to really obtain feedback both before and after an intervention has been modified or changed, to not only adapt the system to their needs, but also to ensure that feedback has been appropriately interpreted and accommodated for. So many times in qualitative research, and for me, I work in the digital health space, we do our interviews, we do our co-design workshops, but who's the one doing the analysis? It's usually the primary first author and someone else from the study team. But why are we not engaging with the community to have them interpret how those interview findings are being reflected into intervention features or program features? Instead, we're using our own sense of interpretation to assume what the community means, when in reality, we haven't really faced the level of context and challenges that they're proclaiming to us. So before we get into the conclusion, I just wanted to also preface that there were a few limitations to the study. The first being that only 23 articles were included in the review due to the criteria of focusing on the design and or implementation of interventions. If I was to go through Indigenous-based research methodologies, which is a whole plethora of literature in a sense, we would have had over 5,000 articles included. But for the purpose of this study, we really wanted to focus on how specific features were developed or co-designed with Indigenous communities for intervention design or implementation. Also, many studies were excluded as their focus was to understand the appropriate mode to approach research or to define the underlying factors contributing to Indigenous health outcomes. So understanding, why is there an increase in diabetes in specific Indigenous communities, or understanding, just factors like access to clean water affect Indigenous health outcomes. That was not the purpose of the study, which led a lot of studies to be excluded. And finally, we also wanted to recognize that within this third strategy, we try to include as many definitions or key terms that reflect participatory research or community engagement. But some studies may not have used these terms to report their community engagement strategies. So that may have led to those studies to not be included. So in conclusion, engagement approaches have been found to allow community members to rebuild their connection and sense of belonging with society that has otherwise been neglected within other aspects of the healthcare system. Despite the claimed use of participatory research, few studies have really adequately used these methods within the design and or implementation of interventions. Thus, with a lack of a proper guideline regarding the modes to execute participatory research, we really recommend researchers to focus on one, building partnerships with the communities to identify their goals, methods of engagement, and priorities that could change or remain at standstill. Second, obtain study approval both during the initial and continuous phases throughout the research process. And third, adapt the intervention with the community's involvement, both during the design stage, the development stage, and the implementation phase to fit the community's needs. And with that, ultimately, there are multiple methods that can be incorporated within a study to improve its effectiveness. But it's really important to recognize that as researchers, we are really facilitating a conversation, and it is what the community deems appropriate that is most important. Thank you.